Hi, everyone. My name is Alexandra Rodriguez. I go by Alex. My pronouns are she, her. And today I'll be presenting on my project, Work COVID Silly Gators, a multi-mural interdisciplinary project to increase COVID-19 vaccine confidence amongst students at the University of Florida. This project was grant funded through the entities below, which includes the Center for Public Interest Communications at UF, Center for Arts and Medicine, as well as the College of Public Health and Health Professions. And a little bit about me, I just finished my master's in public health. I am currently a PhD student in public health at the University of Florida. I'm also a graduate research assistant with the Center for Arts and Medicine Interdisciplinary Lab, where I conduct a lot of my research. And yep, so I'm really excited to share this project with you all. So to get started, in practice, health communication requires collaborative efforts stemming from diverse perspectives to realize its success. And recent literature has detailed how the arts can be mobilized as an innovative form of health communication. And so when utilized as a method of health communication, art can attract attention, sustain interest, shape emotions, stimulate memorable responses, and generate shared symbolic systems. And that's from Sankey et al. 2021, which was a scoping review on arts for health communication, which was actually out of the Center for Arts and Medicine. And so as supported through that same scoping review, photography and visual arts are the most frequently mobilized forms of art for health communication. And so now to expand a little bit more on murals, I have some examples here, but murals are a common example of this practice, and they historically serve as a visual form of communication for topics of importance to a given community, such as social justice initiatives or reform. And with regards to health communication specifically, murals have addressed prominent public health issues such as housing insecurity and health education regarding HIV/AIDS, Ebola, as well as most recently, COVID-19. And as you can see down here, we have some symptoms of Ebola, both written out and illustrated, as well as two other examples here from the literature as well. And so what really inspired this project was actually the Signs of Solidarity initiative between the CDC and Living Walls Atlanta. And so that's an example of a really notable mural-based COVID-19 vaccine confidence partnership. And it supported the effort of engaging the arts to build vaccine confidence in communities with high vaccine hesitancy. And so what they did was they employed artists who were of the same backgrounds of the communities that they were trying to reach to really tailor the artwork and messaging to relate to those communities and to better connect with them to promote vaccination, especially regarding COVID-19, but also just vaccination in general. And then also, to support this effort of engaging the arts to build COVID-19 vaccine confidence within the US, the CDC issued 2 field guides to inform both public health practitioners and artists on how to effectively build creative partnerships, programs, and vaccination campaigns. And that was actually also a collaboration with the UF Center for Arts and Medicine. I was able to be a part of that to help collect some data and some examples that went into that. And so the 2 different field guides, one is actually catered towards artists and how they can collaborate with public health practitioners or the health industry. And the other field guide is actually catered towards public health or health practitioners and how they can partner with artists. So they both have a little bit of different framing to better understand, but yeah, definitely check that out. All right, and so the theoretical basis for this project was the theory of planned behavior, and this theory was chosen as the literature has shown recently for COVID-19 vaccine hesitancy and vaccine confidence that this theory has been effective. And so the constructs that were primarily used in the design of the study were beliefs about a behavior, attitude about the behavior, subjective norm, perceived behavioral control, and intention, all concerning the behavior of getting vaccinated for COVID-19. All right, so the aims of the study. So we had 4 different aims. The first one was to understand the role of peer discussion as it relates to confidence in the COVID-19 vaccine. Second one related to perceived social norms in COVID-19 vaccination. Then we wanted to look at the perceived availability of accurate information about the safety, effectiveness, and availability of COVID-19 vaccines. And then finally, how murals as a communication tool impacted the confidence in the COVID-19 vaccine. And then we utilized those aims to develop 3 overarching research questions that we wanted to analyze. The first one being, how do curated murals focused on COVID-19 affect the perceived social norm of COVID-19 vaccination amongst university students? The second one, how do these curated murals impact student discussion? And then the third one really focused in on if it's contributing to an increase in the number of university students who intend to get vaccinated or are vaccinated for COVID-19. Right. So for this project, we hired on Jenna Horner, who's a really renowned muralist in the Gainesville community. She has a lot of work at First Magnitude, Lululemon. There's a huge mural over at Butler Plaza. She really has quite a few murals here. So if you're in Gainesville, I would definitely check out some of her work. But yeah, so we hired her on for this project. She actually is a University of Florida alumna, and we really came together and tried to understand what the focus of the murals should be, being informed by the theory of planned behavior, but also wanting to incorporate student perspective and what would resonate with students. And so what we really came down to was school spirit, unity, vaccination, togetherness, and reconnection. And so those were our general framings that we'd always reflect back on as we were coming up with the designs. All right, so we had 4 different murals, 2 structures. So this is the first structure, and there was a mural on either side. And we had other muralists come in to paint some of the work, and Jenna acted as the curator for the project. So this one was done by Christy Lopez. And as you can see, there's a lot of unity being shown here, a lot of diversity. We wanted to cater towards a diverse student population at UF. You can see Band-Aids on each of their shoulders representing vaccination in an indirect manner, which was intentional. We wanted to really promote vaccination in a way that wasn't in your face. And we wanted to avoid any adverse responses from people, given that it's a polarized and politicized topic right now. You can kind of see we have an orange and blue color scheme throughout, as well as there's a QR code in the bottom right corner here. And so students were actually able to scan that, and it would go to a link tree with 3 different links. So the first link was for CDC safety and efficacy information. The second link was a website, government website, where you're able to type in your zip code and it lets you know where you're able to get vaccinated locally. And then the third one was a link to our survey for our evaluation data. And this is the other side of that same structure. And this reads Gator Aid, the act of the Gator Nation working together to help fight the spread of COVID-19 with vaccine confidence. And I'd also just like to note that this mural structure was in front of Library West. And if you're familiar with UF's campus, this is a high traffic location. So we have students constantly walking by. And so that was really great to be able to get approval for such a central location for this installation. You can also tell that this is a very different style than the other mural. So we really wanted to bring on muralists with different styles to cater towards, again, the different perspectives, given that the UF community is so diverse. And so this painting is much more abstract, really kind of invites you in to try to understand and dissect what's going on. And there's also subtleties with UF as well. So you can see right here, there's a call to Gator print through there. And yeah, it's really great work, orange and blue scheme again. And that was done by Brittany Weber. And then the other structure was on Fraternity Drive on UF's campus, which is near a lot of student housing. So the fraternities are there. So we have a lot of the male student population there, as well as next to Springs Complex, which is another residential complex. And so given that, we wanted to go a little bit more masculine, given that there was a primarily male student population there. So we ended up choosing to have a male figure in this painting, orange and blue color scheme again. He's flexing his vaccination Band-Aid and also has a mask on. And this is me right here on the left and Amy Lindroth on the right during one of our launch events. And again, we have that QR code on the bottom corner. And then this was our final one on the other side. It read Work COVID Silly Gators. And this one is actually a call to UF football. So if you've been to UF football games, you probably recognize the sign. It's there every game. And so we really wanted to kind of call to the culture, call to something recognizable and put a spin on it that really included COVID, included a subtlety that people would say, oh, that's a little bit different. Like, I wonder why they chose to do that, and to kind of stimulate discussion. And that it's a little bit crude. It's a fun callback. And again, very different from the other work that was included. All right, so the actual study itself and what we were evaluating, it was a mixed method sequential explanatory design, which really means that we had a quantitative piece which was then informed and explained by a qualitative piece. So our quantitative piece was survey data, which we collected both via QR code and in person via iPad within 400 meters of the site. And then we had, after that installation period, a focus group that we did with some students who were on campus during the installation period. And that was great. It was a 45-minute semi-structured interview that then acted to inform any trends that we saw within the survey data, whether they were trends we didn't expect or we wanted further explanation on. So here's a visual representation from the paper for this study. And as you can see, quantitative data, we did the QR code scan of the in-person survey, and then it was analyzed with descriptive statistics. So looking at frequencies, notable trends. And then again, for the qualitative data collection, it was that focus group. And we analyzed it. We did transcription creation, and then thematic coding was what we chose to analyze it with. And then we integrated those results to understand a holistic picture. All right, so some quick numbers here. It was a 3-month installation. We had a 45-minute focus group. We had 229 QR codes scanned and 222 people surveyed. And I'd also just like to clarify that the 222 surveyed is not just from the QR code scan, it's also from in-person. All right, so now to go over some of the quantitative data from the study. So one of the questions on the survey asked, how often do you see any of the murals while on campus? And we went ahead and created a 5-point scale and defined the terms. So we very clearly outlined what we considered to be very frequently versus rarely. And we saw that a good portion of people saw it either very frequently, regularly, or occasionally, which was great to see. And then even from that, we saw that 92.1% reported seeing a mural at least once every 2 weeks, which was great. And then another question that we posed to them was, how often have you discussed the murals with your peers? And we broke this down by some of the demographic and other questions that we asked. And so some notable trends here, the highest percentage was amongst those who identified as Black or African American, and the lowest was of those who identified politically as being Republican. And then some between groups amongst, or between male and female, we saw a notable change between the two, as well as between Republicans and Democrats. Then I'd also like to note that the gender other is actually relatively low compared to everything else as well, but we consider that an outlier given that we had so few respondents select gender other. All right, and so we also asked, how often have you discussed the murals with your peers? So 70.43% of all university participants discuss the mural at least once with peers. And so there also was a statement that we posed that asked, the murals have led to the discussion of the COVID-19 vaccine with my peers at the university. This is de-identified from the paper, but it read the University of Florida. And it was a 5-point Likert type scale. And we saw that 21.37% either strongly agreed or disagreed with that statement. And then something that was interesting that we ended up bringing up with the focus group was that we saw 35% of people were neutral on this. And I'll get into that a little bit later, but they really observed this as people wanting to not choose a side in a politicized, controversial topic. And so that was their way of remaining neutral on the topic as a whole. Get into. And then another point that was brought up was they were also asked to relate to this statement, which read, the links provided on the mural's QR code improve my awareness of local vaccination sites and or information on the COVID-19 vaccine. And with this, we saw 48.48% either strongly agreed or agreed. And then for our qualitative data, so again, this was the focus group that happened after the mural installation period with students who were on campus during the installation period. And one of the direct questions that was posed to them was, of the murals you engaged with, which features or aspects did you find captured your attention most and why? And the really central themes that emerged from this were that there was a lot of representation of diversity and inclusion. It was a central location, both murals sets, and the artistic range, as people are attracted to different styles. So they were really appreciated that we had such a range there. We also had a discussion on the value of curated public health mural installations. And some themes that came up from that were that art distributes health information in a less intimidating way, that art resonates and sticks with people, and that art drives conversations, which can begin to change perspectives. All right, so now to go over our 4 findings. So the first one, we found that curated murals focused on COVID-19 increased discussion around COVID-19 vaccination. And so supporting this, we saw that 70.43% of respondents reported that they discussed the murals at least once with peers, and that it captured their attention with the diversity inclusion, the central location, or artistic range. And 21.37% agreed or strongly agreed that the murals led to the discussion of COVID-19 vaccine with peers. And then again, I had brought up a little bit earlier, but the 35.11% responded neutral to whether or not the murals led to the discussion of the COVID-19 vaccine. So from the focus group, they really brought up this idea that that was their way of being neutral on the topic of COVID-19 vaccination in general. And here's a direct quote from our focus group. "It's so political and controversial, it makes a lot of people uncomfortable to pick a side. Someone might perceive me wrong and against them." Our second finding was that curated murals focused on COVID-19 do not directly affect the perceived social norm of COVID-19 vaccination amongst university students. So what we saw with our data set is that a strong majority, so almost 95% of respondents, had been vaccinated at least 1 dose for the COVID-19 vaccine. And so with that, the focus group identified that the murals did not conflict with prior perceptions. And so it didn't shift a social norm that was already established for the people who were taking the survey. So that was something that was interesting that came out of this. And then finding 3 found that murals can increase perceived availability of accurate information about the safety, effectiveness, and availability of the COVID-19 vaccines. So that was really seen through the QR code data. So 48.48% of student respondents who had scanned the QR code either agreed or strongly agreed that the links provided improved awareness of local vaccination sites and or information on the COVID-19 vaccine. And that really aligns with the literature that health communication can increase awareness and knowledge on a given topic. All right, and then our last finding is that curated public health mural installations can resonate with viewers while promoting health conversations in a less intimidating manner. And so some of the themes regarding the value were that it resonated and stuck with people, it distributes health information in a less intimidating way, and that it drives conversation, which can begin to change perspectives. And that again aligns with the literature as arts-based health communication attracts attention, facilitates conversation, and sustains interest. All right, so some of the strengths of this project. So we had triangulation of our quantitative data. So not only did we collect data via QR code, but we also collected it in person. So we had different sampling methods. We had tailored communication. So we were very intentional in the artwork in trying to appeal to the audience that we were trying to reach, our priority population. It was an interdisciplinary approach. So not only did we have a public health lens on this, we also had an artistic lens and really brought in both perspectives to come up with a holistic strategy. And then it was also a sequential explanatory design. So the fact that we had both quantitative and qualitative data, which informed that quantitative data act to strengthen the design of the study as well. Some limitations, we did do convenience sampling for our data sets. And so it was not randomized. And so this limits the generalizability of the data. We also did not have any follow-up data. So, it would have been great if we could have collected data at the start and at the end of the installation period from the same people to have a change score. So that's something that could have occurred. And then we didn't have any statistical power. So even though we had quite a few respondents, over 200, relative to the student body population of over 50,000, it did not have statistical power. So with that, it limits the generalizability of the results. All right, and then future recommendations. So we would increase the in-person sampling locations. We'd add a focus group to discuss mural options prior to finalization and installation. So before the murals are even finalized, the designs, we would have had a focus group then see what resonated or maybe what wasn't resonating with them, and what could be better in that initial design phase, as opposed to bringing in students at a later point. Also to increase the number of focus groups to gather a more diverse perspective at the end of the study. So during that qualitative piece. All right, so in the press, so these are some of the different coverage that the study got. If you're interested, they're linked and you can definitely check them out. And those are the references. If any of you would like to connect, speak more about this, or if you have any questions, feel free to send me an email. My LinkedIn and Twitter is here as well. I post a lot about arts and health work and arts and public health work. So I'd love to connect with you if that's something you're interested in as well. Thank you so much. And I hope you all enjoyed this presentation.